How to recover from a rotator cuff shoulder injury. If you've got shoulder pain, you can't train properly, your shoulder hurts in some day-to-day movements, maybe you've been diagnosed with a rotator cuff problem, or that's what you think it might be, well then this video is for you. We're going to fix your rotator cuff in 3 phases. I'm also going to explain them and give you the exercises you need to do to get this fully recovered. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin. We specialise in helping people recover from pain and injury. The great news about shoulder injuries are that you can fix them with exercises. Manual therapy, injections, massage, etc. are not needed or beneficial in anything other than some short-term pain relief sometimes. There are multiple benefits to using exercises for shoulder pain and injury. Not only does it affect the physical structures like muscles and tendons, it also reduces the fear and the threat. It builds your confidence and it reduces avoidance where you overprotect the shoulder and mind it too much, which can itself cause pain. The beauty of this approach is that you are going to fix your shoulder without doing lots of rehab-y, physio type exercises. Traditional strength exercises stress and strengthen the rotator cuff. You don't have to bring your shoulder out a rotation position to work the rotator cuff. As we will see, the rotator cuff works in lifting the arm up, back and out to the side. And in a very sore shoulder, it's often a bit sore to go out into those positions and you can't really stress it that much. The exercises are awkward to set up and perform, so this is going to be a much nicer, more effective way to address your rotator cuff. So what is the rotator cuff? The rotator cuff is a group of small muscles that help to stabilize but also to move your shoulder. When we look at the rotator cuff, there are 4 muscles, but let's divide the rotator cuff into 2 categories. The front of the shoulder is the subscapularis and the back of the shoulder is the infraspinatus, supraspinatus and teres minor muscles. The back of the rotator cuff is very involved in pressing and the front of the rotator cuff is very involved in rowing or pulling. It's like a little tug of war on your shoulder joint. So pushing your arm forward or pulling it back works parts of the rotator cuff very differently. Lifting your arm out to the side works the entire rotator cuff equally. So if you have a very sore shoulder, lifting out to the side and those movements here are going to annoy it and irritate it, and we'll avoid these positions in phase 1, but we'll introduce them then when it's able first. So most people think if they've got pain at the front of the shoulder, they need to strengthen the front of it, where it's actually the exact opposite. And doing that can just make your shoulder pain worse. You need to do some pulling movements to get rid of that pain. So let's say you've got pain at the front or the top of your shoulder. Phase 1 will involve 3 things. Number 1, stop doing the movements initially that hurt it, so no pushing or pressing or anything that annoys it. Number 2, start with an appropriate dosage of pulling exercises. And by appropriate, I mean make sure you're doing enough. We can generally do more than we can think. And thirdly, in phase 1 and 2 actually, all the exercises involve keeping your elbow in close to your side. Pulling exercises will really strengthen the subscap muscle and it won't stress the infra or supraspinatus tendons, which are often the main source of pain. So phase 1 involves 3 exercises. We're going to go with 2 pulling exercises and 1 other exercise where the elbow is kept close to your side. Phase 2, we're going to introduce some pressing and pushing exercises, but we're still going to keep your arm close to the side. And phase 3, when the rotator cuff is stronger and can tolerate more load from doing those exercises, we will introduce some exercises where you're lifting your arm out to the side, which is fantastic for strengthening the rotator cuff. It's just, that's too sore to start with initially. So phase 1 exercises, let's go with the first pulling exercise. If I'm doing my left arm, it's handy to go down onto my left leg and I'm pulling this down and back. So keep my elbow in close to my side, pull it down and back. You can often bring in a little side bend as well. Make sure there's sufficient tension on the band. And look, you can see I'm letting my arm go all the way forward and I'm pulling it all the way back. So as I'm doing this exercise, I'm feeling some muscle activity here. Is exactly where you want to feel it. You mightn't always feel it there, initially anyway, but this is sometimes if you put your hand on it, you can feel that working. It's not absolutely crucial because not everyone feels it, but keep your elbow in close to your side, have sufficient tension, pull your arm down and back, and make sure you're doing enough of them. Just loosen it out afterwards, okay? There's our first pulling exercise. What can also help, if you're doing this at home, you can throw it over a door, but if you're able for it and you can get your arm up that high, we're gonna pull from this position. Again, keeping the arm in close to your side, pull your elbow down. So you're working this area here. Again, holding it down enough. Now, if it's too sore to get your arm up there, don't worry about that exercise. Just focus on doing enough in this position. For some people, lifting their arm up any higher than this height would be annoying, so forget about that one and just do the previous one. The third exercise then, we're going to keep your arms in close to your side, keep it nice and relaxed, and just go to open your arms out. You're doing this position here, but there should be resistance obviously with the band, and hold it there for maybe 5 seconds with some intent out into the band and bring it back in. So this is how it looks from the side. Hold it there and back in. Now as I'm doing that, as you go on, you'll feel a little bit of muscle activity there. And it's absolutely fine to feel it there, even it's fine to feel a little bit achy and sore. Think of some of that soreness as weakness. So you have to strengthen the area in order for the pain to go, as opposed to, I'm gonna wait for the pain to go and then I'll start doing the exercises. These are safe, very, very safe exercises. So get to the point where the shoulder feels tired, more so than sore, doing those few exercises, and in between it, keep your arm in close to your side and move it nice and freely. So even if you just did the first pulling exercise on that one and did 2 or 3 rounds of it, you would feel a little bit freer. That should give you the confidence to do that more frequently in your day. You might have to stay on that for a week or 2, doing it twice in your day or once in your day. It should give you some pain relief, it should give you some encouragement to keep doing it. Let's move on to our phase 2. We said we were going to go and introduce pushing and pressing. So you would do those to warm up. They'd be the first ones you'd start with. And then if we're going to go with some pressing, keep your elbow in close to your side here and see if you can push all the way out. So again, elbow in close to your side, pushing this forward, and your fist should finish pretty much in front of your shoulder joint. Get sufficient tension on it. Push all the way out. All the way back in, nice and controlled. And again, go to the point where it's tired, not sore. Going to go with some pressing exercise. Again, if you have the band like this, you can get it in this position here and just press it up over your head and down. Remember, you've done the pulling exercises from phase 1 first. This should get your shoulder tired. You might even feel it's a little bit more fatigued than the other one. Keep the banding close to your side, up past your nose, all the way back down. So those few exercises, if you're able to put all those together, will work your shoulder quite a bit warmer and looser and less pain, and you've worked it. And that should encourage you to do a little bit more of it, which is strengthening your shoulder, giving you more confidence, and then you'll start to notice you're able to do a little bit more in your daily life without suffering in pain. Let's move on then to phase 3 exercises, where you're gonna move your arm out to the side and stress it a little bit more. For this, we're gonna use a dumbbell. The first one we're gonna do is sideline external rotation like this. Keep your elbow in close to your side, up as high as you can, slowly all the way back down. Keeping this elbow pinned, try not to let that lift. And again, you should feel a lot of work towards the back of your shoulder. Stop when you feel you could only do 2 more reps. I would imagine if you compared yourself doing it on your good shoulder to your affected shoulder, it would probably fatigue a little bit quicker, which is just more of a sign that it needs this type of strengthening work. And then the last exercise, when it's able for it, which is really good for your rotator cuff, is if you can bring your arm out to the side like this. Again, choose a weight that's doable without it being too sore or too heavy, all the way out to the side to about head height, and slowly all the way back down. That works all of your rotator cuff relatively equally, which is a fantastic exercise to do. So when your pain is gone and you're back doing everything you want to do, if it's not too sore and sensitized, if I could give you one exercise to keep that shoulder strong, it would be to have a light weight in your hand and do this lateral raise. If you're into your training, doing this should mean you're able to go back and do lots of stuff in the gym. If you have any questions on any of that, we have several other videos on how you rehab and treat rotator cuff injury. Comment below and we'll be happy to get back to you.